So you want to know what evidence-based practice is, EBP. Well, according to Professor Ed Peel of Warwick University, who is the head of the medical education department, it entails making decisions about how to promote health or provide care by integrating the best available evidence with practitioner expertise and other resources. This includes characteristics, states, needs, values, and preferences of those who will be affected. So in other words, it's the integration of the best research found that is with clinical expertise and patient values. So you want to know, how do you identify a problem in nursing practice and develop a question to research? Well, first thing you want to do is you want to ask the burning question. Now, this can come from daily practice, while you're in class, or while you're reading a professional journal that's on a specific topic. So this comes up with a specific patient, a group of patients, or a unit. Now, my example is that patient BB8 slipped and fell in the kitchen. He popped his head. So the question is, what can I do to prevent him from falling in the future? So what I would do is I would check the policy, and I'd check the evidence that was given for that policy, and I'd see if there's any references. Then I'd see if there's any background or foreground. So background is a fact that most experts agree on. Foreground is normally based on the relationship and can be controversial. So foreground is either qualitative or quantitative. So when it's qualitative, it's subjective, and it asks about the meaning, experiences, and analyzes the information of the interviewee. When it's quantitative, it's objective, which means it's measurable and statistical, and it focuses on the data collection and data analysis. When you're asking the burning question, you want to follow the PICO policy, which first is population. So it's a specific group of patients that the question applies to. And then there's an intervention. So it's either a well-supported new therapy or a risk factor. For example, the kitchen needs traction on the floor, such as a yoga mat. That way, BB8 doesn't slip on it anymore. And then what you want to do is comparison, which is the standard or current treatment. There's also the outcome, which is the measurable or desired outcome. So we're going to measure BB8's pain, his length of stay in the hospital, and if he needs to go to rehab. Last is the time. So at that point, you have to check the time period. Now that we have our burning question, we want to know what the best evidence is. That leads us to the evidence pyramid. So the good thing about this pyramid is that the higher up it goes, the better the quality of the evidence is. So now we go based off of this. So it gives us things such as expert opinions, case studies, case control, cohort studies, RCTs, which are randomized control trials, and systematic review and meta-analysis. So on the lower end of the hierarchy is expert opinion. That includes your PhDs, MDs, and RNs. And as convenient as this section is, even if it is from the most reputable source, it could be framing off of their own opinion and their own selective bias, which could be an issue. Moving up on the pyramid are case studies, and even though they are in the lower end of the pyramid, they're not unimportant. Take, for example, an unknown lethal virus during initial breakout. Let's call it the Sith breakout. So we don't have enough time to evaluate what they thought was causing people to turn into Sith. So for the few people that decided to make the transition, we are going to describe their phenomenon and some of the exposures that they may have had. At that point, we're going to look for commonalities because only a small amount of people have become Sith. Next is a cross-sectional study, and this shows us an association or a prevalence. There are enough people in the sample population that can give us an estimate as to how many people actually have the disease. The only problem is that not enough time has passed to show the longevity between exposure and outcome, and this just ends up being a snapshot of the entire situation. What you need is a cohort study, and this can calculate an incident rate and a relative risk statistic. This gives us a relative and absolute risk reduction and the numbers needed to be treated. This study also gives us a commonality from a prospective and a retrospective cohort. The RCT needs authentic randomization and a critical thinking control to establish good treatment and causation. The SRMA is done with the highest quality of evidence, and it's done with a certain protocol, such as a search engine criteria that excludes literature that is not up to par. Okay, so what you want to do is you want to use the Fantastic Four. That includes Cochrane Library of Systematic Reviews, Joanna Briggs Institute, JBI, Systematic Reviews, Medline or PubMed, and Cumulative Index to Nursing and Allied Health Literature. So the third thing you do is critically appraise and synthesize evidence. This is a collaborative team effort, and each team member is shown an article to critically review. They come to an agreement on what is the best evidence to answer the question. The fourth thing is you want to make a recommendation to improve the practice. The evidence is reviewed, appraised, and created into a report for approval. The fifth thing is you're going to implement the recommendation. A plan is developed. It should improve the practice and patient outcomes, and it's systematic, consistent, and shared. So the last thing you want to do is you want to evaluate the outcome, and that requires a reliable measurement tool. So when you do that, most of the tools don't require permission, but you want to ask just in case to make sure which ones you do need permission for, because if you don't get permission and you really did need it, it could be no bueno for you. So now we want to know what defines a nursing journal. So when you're defining a nursing journal, you also need to know the time frame from when the research is performed and to when it is integrated into nursing practice. So what we do is we use a different level of evidence. This includes the systematic review meta-analysis that we all know and love. You also put it to trial, you study it, you survey it, and then you write a literature review. And it also has a minimum of at least one author that is a nurse. So at that point, you want to make sure that it's within a certain time frame, preferably 5 years at least. And then once the research has been verified and approved, you want to make sure that it's implemented into practice.
We start the implementation phase with the exploration stage. You assess the match between the community and the new evidence-based practice. You also make the decision on whether or not to proceed at this point. Second is the installation stage. This is the time it takes to make sure that everything is structurally put into place. Third is the initial implementation stage. This is where the plan is used with the first generation, also giving us the opportunity to change things and improve them. Finally, we have the full implementation stage. This is when everything is fully implemented into the entire facility and it becomes policy and normal procedure.
So with that, we want to check the time frame that will vary depending on the depth of the research. That's normally ranging between 2 to 4 years. So now we ask ourselves, how do you determine the quality of the nursing research? Well, we look for the level of evidence, the systematic review, with the number of patients in the study. If there's more patients, then there's more data. So that's something that we look at too. We look at the date of the evidence, again, within 5 years, and we make sure that it's peer-reviewed. So an example of evidence-based practice change in an institution would be a recently published evidence-based project described the risk factor for hospital-acquired urinary tract infections. These are the most common type of nosocomial infection. This is a multifaceted quality improvement project that decreased unnecessary Foley catheter use and increased order documentation. This was instituted throughout the Minneapolis Veterans Affairs Medical Center in March of 2005. So this had a bundled intervention which included multiple types of education, system redesign, rewards, and feedback. That was phase 1 and 2. Phase 3 included the involvement of a dedicated Foley catheter nurse. So this had a significant hospital-wide reduction in total and inappropriate Foley catheter use and improved Foley catheter order documentation. And this was achieved through a multi-component campaign.